Good morning. My name is Dr. Debbie Shepard. I'm a local pediatrician serving as Vice Chair of the NCH Department of Pediatrics and Chair of the Safe Sleep Committee for the NCH Safe and Healthy Children's Coalition of Collier County. This morning, leaders in this community come together to increase public awareness of the impact of unsafe sleep practices on infant deaths. Sudden, unexpected infant death is the leading cause of death of children under the age of 1 in Collier County, and over half of those children who died were in an unsafe sleep environment. SIDS, Sudden Infant Death Syndrome, is a term now used only when any other cause, including suffocation or overlay, has been ruled out. I'd like to introduce Dr. Betty McIntyre, Executive Director of the SIDS Institute, who will review the national and local data.
These types of deaths have occurred from the beginning of history, and there's no greater tragedy anywhere that can happen to a family. In a typical situation, parents put an apparently healthy baby down for a nap or down to sleep for the night, and they wake up and the baby is dead. This happens from 4,000 to 5,000 times in the U.S. each year. The rates have gone down as public health campaigns have taught parents to not sleep with their babies and to put their baby in a bare crib. We had 4 such cases this year in Collier. We had none the year before. That was very good. And this happens all over the world. When I first started studying these deaths, we did call them SIDS. Now they're called SIDS, SUID, undetermined, various things. But we had over 11,000 babies in the U.S. This was in the 70s. So we've done a lot to prevent it. When I hear parents say, but I slept with all of my children and none of them died, I think yes, but we were definitely doing it wrong back then. And there is a message that we can reduce the number and incidence of these terrible tragedies to families by following the advice of these people that you'll hear today. Thank you.
We thank Mike Carroll for being here. He is the Managing Director of the Suncoast region of the Department of Children and Families, and will discuss the state data and the statewide campaign led by DCF.
Thank you. First, I'd like to thank everybody for actually showing up today and helping to get this message out. This is probably one of the most important issues that we deal with at the department. January, beginning of January this year until this morning, we investigated 43 deaths statewide for children who died for causes related to the safe sleep environment. 8 of them in the 20th Judicial Circuit, which is the 5 county areas surrounding Collier and Lee counties. This is a tragedy that is inherently preventable, and it's one that crosses all socioeconomic lines. A lot of times when we talk to folks, we get the response, can't happen to me. I appreciate Dr. McIntyre actually referencing that some folks think that they've done this their whole lives with other children, won't happen to this child. And that's just not true. We never know when this is going to be happening, when it will happen. And it's difficult to predict. But the American Academy of Pediatrics tells us that the safest way to keep a child safe is to put them in a crib by themselves on their back. And the crib should be free of any blankets or pillows and that type of stuff, which kind of flies in the face of what you see when you go to a store, right? You go to Toys R Us, you look at a crib, every beautiful crib there is filled with all kinds of pillows, blankets, and looks like the greatest thing you've ever seen, and it can be unsafe for kids. Or if you ask your grandmother or you ask somebody from my generation, they tell you that stuff's okay. In fact, I was always told to put a child on their belly, right? So we haven't always done it right. And because of it, we have children that really are in unsafe situations. 143 children in the state of Florida from January today have died due to unsafe sleeping arrangements or something related to it. This is something we can prevent. We at the Department of Children and Family do have a safe sleep campaign. It's on our website. We have several public service announcements. Those are free to anybody that wants to use them, and we can certainly get the message out if anybody's interested in them. We have a lot of literature, and I encourage you to go on the website to take a look at that. But most of all, I think it's grassroots campaigns in each community that's going to help do this. That's why I thank NCH for hosting this, and I thank all the children's service agencies that are here. I thank the Sheriff Rambosk and his staff. Often they are the folks, in fact, they're the folks who have to respond in cases like this, do the frontline investigation when we lose a child. So it really is a community coming together to get the word out. We have to get this message out in so many different ways to so many different people to make this happen. But 143 deaths last year, and none of them needed to occur. This is something that we can eradicate. So thanks for being here. Thanks for working with us.
The Safe Sleep Committee has been working with members of the Collier County Sheriff's Office, and we thank Sheriff Kevin Rambosk for attending. And he will now speak about his office's role in the investigation and prevention of infant deaths.
Good morning, everyone. As you've heard, tragically, in 2013, our office was involved in the investigation of a number of co-sleeping incidents. And I think, when we respond with our public safety partners, fire rescue, EMS, and deputies and law enforcement, we're impacting the same type of heartbreaking investigations when we look at those individuals that are a month old, 2 months old, several days old, and we all knowing in public safety and in healthcare that this is a preventable type of an event. So as we learn more about what we can do to help the community prevent these types of incidents, I'm here to commit to work towards that effort with all members of the Collier County Sheriff's Office, the community, NCH, the Safe and Healthy Children's Coalition of Collier County, because if we work together, we can prevent deaths in the future. Thank you very much.
Dr. Harry Moreau is a neonatologist and is vice chair of the Coalition's Safe Sleep Committee. He's been instrumental in educating those in our community caring for our young children.
Good morning, everybody. I'm going to share with you what the members of the Safe Sleep Committee have been doing in the past 2 years. My first lecture was at the Polisano Children's Museum. I addressed the Department of Health nurses. Shortly after that, Paula invited me to give lectures to the senior nurses at the Edison College. And between the two of us, we've given 4 to 5 lectures to the nurses. Dr. Shepard and I, we've given several lectures to the community leaders, nurses, doctors, medical examiners, to the program directors of the Early Learning Coalition of Southwest Florida. Paula has given several lectures. This month she gave a lecture to approximately 30 mothers of Head Start from Parkside. Dana Breeden, the Department of Health, has trained over 200 child care workers, and now they are trained. Thanks to her enthusiasm, approximately 7 to 8 child care centers are now safe. She's given approximately 15 lectures to the team from the TAP program in Immokalee. I thank the community, I thank NCH, I thank the members of the Safe Sleep Committee for this press conference, and hopefully our goal will be reached, and hopefully in the future We will present more press conferences like this, lectures, in-services, conferences, so we can reach those at risk and prevent those sad tragedies. Thank you very much.
Good morning, and thank you very much for having me here today. The initiative in Collier County and all the health agencies and first responders. My name is Betsy McCormick. I'm from Charlie's Kids. Charlie's Kids is named after my nephew Charlie, who passed away in 2010 at the age of 3 weeks. His mom is a kindergarten teacher, and his dad is a pediatrician. Much like any parent, in the middle of the night, you're exhausted, and his father, Sam, fell asleep on the couch with Charlie on his chest. When Sam woke up 2 hours later, Charlie did not. And since that time, we started this foundation in an effort to help other parents be educated about safe sleep practices and how to reduce the risk of SIDS. And this year, we're very excited because we have published a children's board book, which is available over here, called Sleep Babies, Safe and Stuff. We've printed over 218,000 of these books, and they are very happy that they are going in every Cribs for Kids Safe Sleep Survival Kit nationwide, and several health organizations and community organizations and pediatricians' offices are also distributing them to their new parents. Our goal is to educate new parents and grandparents, as Mr. Carroll explained, that older generation might have different feelings, and also caregivers. So our component is, through our book, it's a gentle reminder for parents as they put their baby to sleep. It also promotes literacy and bonding with their family. And we hope that it will eradicate or at least help reduce the risk of SIDS for families so that nobody else has to go through something like this. I appreciate the opportunity to be here today. It has been a tough 3 years, but a very rewarding and inspiring 3 years for our family as we try to honor Charlie and help other families with this horrible tragedy. Thank you very much.
Marnie West is a nursing program specialist with the Florida Department of Health in Collier County, Healthy Start Coalition of Southwest Florida, and she will now describe a safe sleep environment and demonstrate the positioning of the baby in a crib or pack-and-play.
To prevent any more tragedies, I'm going to demonstrate what a safe sleep environment should look like. First, you want to make sure that you have your baby on their back alone in the crib. You want to make sure that you place the baby on the back, face up. You don't want any bumper pads, no extra pillows, no blankets, and no toys. You want the baby to be alone in the crib. As you can see here are some examples of unsafe sleep. There should be no co-sleeping with a parent or a sibling, no sleeping on the chest of a parent, no extra toys, no bumper pads. Bumper pads come in a lot of bedding for the babies, and they may be cute, but they're not safe. So no bumper pads and no extra blankets. This is an example of how a baby should sleep in a crib, on their back, alone, with no extra materials in the crib. If it's colder temperatures, you want to make sure that the baby may have a sleep sack. You can put the baby in a sleep sack, wrapped nicely on their back in the crib. And that's an example of a safe sleep environment.
Thank you. Dr. Alan Weiss, the CEO and President of the NCH Healthcare System, will now say a few words about the Coalition and NCH's efforts in this area to reduce infant deaths.
Thank you, Dr. Shepard. I apologize for my voice, but not the message. Hearing Charlie's chilling story, having this group together sort of focuses me on 2 points. Number one, this is a team sport. No one alone, either the caregivers or fire and safety folks, parents, or any media who are very, very important can do this alone. Everyone working together, in this example, the help a child, newborn and up to under 1-year-old, sleep well and sleep safe, is the example. Taken in a broader sense, when you think about the Collier County's Safe and Healthy Children's Coalition, which got formed about 4 years ago now, is a perfect example of groups getting together, much like the group that's here today, to work on initially drowning in toddlers and children under age 5. But you looked at that group as it got together, very precarious at first, but commonly focused, well organized, and now basically self-sustaining with a full-time person, Paul, who's working as part of NCH. That is what a good community does. That's what all good community citizens do. NCH as a community partner with Sheriff Rambus, with our fire department, with our physicians regional, with everyone else who's in the community involved, Boys and Girls Club, and everyone else, will make this a better and healthier, safer community for everyone. So far, right now, we're focused on the very young. But we think about another big initiative. Naples Daily News did a wonderful story, which ran last Thursday with our reporter Liz Freeman, talking about blue zones. Basically, where more people live to be 100. If you think about a child who dies prematurely at age 1 or before 5, and you add that child's life expectancy up to 100, changes the whole tenor of our community. We now have the longest life expectancy for women, second longest for man, fifth least obese. We have a shot at being the healthiest community in the nation. Working with this problem, this concern, Charlie's concern, is a huge step forward for everyone. And again, it's going to take everyone working together as we go forward. So thank you for getting us organized. Thanks for this opportunity. And I can't think of a better way to continue to be proactive and forward-looking. Thank you, Rich.
Thank you. Finally, we want to enlist you to help us. First, as a parent, grandparent, or caregiver of a young infant, ensure that every infant is in a safe sleep environment as we described here. Spread the word to all who care for children that an infant should be alone, on his or her back, in a crib with no loose items. We would also like to assure that all children in Collier County have access to a safe sleep environment. We are very grateful to Trinity by the Cove for a grant given to the NCH Safe and Healthy Children's Coalition last year, which provided 112 pack-and-plays. The pack-and-plays have been given to needy families who qualified upon application and then education through the Healthy Start program. But we are almost out of those precious items. If you would like to donate a new pack-and-play, maybe put it on your Christmas list, you may do this by donating online at www.safehealthychildren.org. Or you may drop off a new pack-and-play at the Florida Department of Health in Collier County, or the North Naples Fire Control and Rescue District Station 25 at Veterans Park. We want to thank those individuals for offering those areas as drop-off points, Dr. Joan Culper and Chief Orly Stoltz. So thank you for that. Mr. Larry Graham, store manager at the Walmart Supercenter at the North Trail, has agreed to match the online price of these pack-and-plays of $49.88 at his store. So go Christmas shopping. Healthy Start will assure that a qualifying family receives this gift of safe sleep, and the staff will assure the family receives education described here to assure a safe sleep environment. I also want to thank the following community leaders for being here who did not speak. Chief Walter Kupka of Collier County EMS, Kathy Tamuto of Healthy Start Southwest Florida, the Executive Director, Dana Breeden, who's been instrumental in educating our preschool and early child centers. She's of the Southwest Florida Early Learning Coalition. And Jackie Stevens, the Children's Advocacy Center of Collier County. She is the Executive Director, and their agency is involved in these investigations as well. I thank everyone for attending as we continue to strive to increase the safety and health of our most precious commodity in our community, our children. Thank you.